This is my final project video for my VECR experience at Fred Hutch. So the highlight of my experience was one of our guest speakers, Alicia, who talked about imposter syndrome. And this was a highlight for me because I've never really heard about this, and I found it kind of interesting and engaging, specifically to see someone talk about mental health and mental struggles. When I signed up for this experience, I expected to learn about cancer research, scientists, but nothing about my personal experiences or how to cope with being in such a stressful field. And I also really liked it because I find in my personal life, especially in the education system, there can be a stigma around mental health and it's not really talked about. And that can sometimes be difficult on myself or my peers. And so when we did this, she asked us to, or I don't know if she asked us specifically to, but she talked about how she had drawn her imposter experience, how she saw it in her head. And after her presentation, I went back and I drew what it felt like to me because I really like art, and this was something I've never really heard about and I wanted to understand it further. So this is kind of scary to share, I won't lie, but one, I needed a visual aid, and two, I think it's important to have discussions on this topic, even if they are difficult, because it raises awareness and it can help us combat it. For my news story, I chose the article, "A Path Opens for Precise Analysis of Breast Cancer Proteins." And in this article, researchers are studying how to create more precise drug prescriptions for breast cancer patients. And so what they're doing to work on this is they're matching proteins that exist on the surface of these tumors with a drug that would fight the cells that have similar features to those proteins, if that makes any sense. And this could allow better understanding of the proteins, which allows, more precise, more effective drug prescriptions, which in turn would allow more effective therapies and healthier patients and higher rates of success. So the overall goal is to use human clinical trials to measure the amount of protein within the breast cancer tissue. And they're specifically looking for this protein called HER2. And I have a photo of this. Wait, there we go. And you can see this is a normal breast tissue cell. And you can see that there's genes within the cell, and that in turn creates these little receptors on the outside that respond to growth factors and stuff. And if a mutation occurs or a problem occurs and more genes happen on the inside, that in turn creates more receptors. And that can become a problem because then there's an excess of these cells being produced because they're taking in more of those growth signals because they have so many receptors on them. It's a little confusing. But excess growth of cells can create tumors and create problems and cancer. And this is something that's already being tested. But the thing is, the tests aren't specific enough. Sometimes if there's too low of a level of HER2, it can't really measure it. And this can create some ineffective treatments. So they're hoping to create more specific tests. That's at least my understanding of it. It's a little confusing. So this would also be really good because it would allow more knowledge on the subject, and whatever they find, the tests that they're able to produce could be used for other cancer therapies outside of breast cancer. And it could also lead to quicker verification after human trials, so that because there's more known about the subject and more known about the issue. And then finally, the researcher behind this is Dr. Amanda Polovich. Sorry if I got your name wrong. And she's been working on the concept that I explained before, which is matching proteins that are existing on the surface of the tumor with a corresponding drug. And she's been working on that for 16 years, which is pretty impressive, honestly. She's a leader in proteomics, which also I'm not sure if I'm pronouncing that right, which is the study of proteins. And her work helps find treatments that are tailored to individual cancer patients, which is really important for successful results. And finally, I also chose this topic because I know people who have had breast cancer. It's a very common issue, and I think that it's good to educate myself on this subject so I have more knowledge about it. So that's all I have today for my video. Thank you, Hutch, and I'm excited to continue learning about this in the future. Thank you.